watching the It's Her Time podcast with Cody and Jess.
Hi, welcome back to the It's Her Time podcast. My name is Cody Sanders, and I'm a holistic health practitioner and functional nutritionist and the host of this show. And we love to get on these shows and talk about you as women, about your health and happiness and how you can be your own best health advocate. And today I'm really excited because I have two special guests joining me. You'll recognize one of them, Jess. She's my business partner and is often on our podcast. But I also have Sine, and I'll give her a minute to introduce herself in just a moment. But today we're celebrating International Women's Day. It's a holiday that's celebrated all around the world, and I think it's just kind of building momentum over the last few years here in the United States. But we love this holiday because as women, obviously, this is an opportunity for us to really dive into areas of where women are excelling and where there could be a lot of, improvement in the lives of women. And so that's what we're going to talk about today. Specifically, we're going to be talking about gender inequality when it comes to medical research. And you know that I am very fired up about this. I talk about it often on our podcast episodes, but I'm going to dive into some specific stats and research that's out there because I think it will literally blow your minds. But before we dive into all of this, let's hop on over to a Mixers Girl Say.
Hello, everybody. Today for our Mixers Girls Say, we're actually going to go into a fun personal question.
Love it.
A few weeks ago, I was able to speak at an event that was all women, and the whole topic of conversation, was around self-love.
Yeah.
And I think something that kept coming to my mind is self-love can mean so many different things to different people. And so we reached out to our Mixers community and I asked, what does self-love mean to you? So I have a lot of what women wrote in about what self-love means to them. But before I get into these, what does self-love mean to you?
Well, I used to think it meant like pampering. But then what I've learned as I've grown older and wiser is that it's about staying true to the commitments that I've made for my betterment. So, respecting myself, like doing the things that I've said mean a lot to me, sticking to that and putting myself first is a really great form of self-love because it's helping me to be able to have the care and have the ability to be able to do all the other things that mean a lot to me too. So,
I think for me, something also that comes along with like aging, and there's so much fun, there's so many fun, beautiful things that come along with aging.
Yes.
And to me, I agree with you. Self-love used to mean like, okay, I make time to get a massage, which I do still love to do.
Love it too.
But more so for me, self-love has become truer to those two words, self-love. It's like instead of the pampering and the fun, like extra care things, which are so fun, fulfilling, make you happy, good for relaxation. To me, self-love has meant, do I love myself even if no one else does? What do I love about myself? Where can I improve? It's about being aware of things that you can change and like loving yourself through changing.
I love that. That's so good.
So, yeah. Okay. So some of our Mixers community wrote in, and I'm going to share just a few of the submissions from our community. Taking time for yourself and respecting your well-being, both physical and mental. Yes. From Emmy. I love this. From Cody with a K.
Is there another Cody out there that's a girl?
Yeah.
Makes me so happy.
Stopping the negative thought spiral is self-love. That's so great because it's so like you start to feel yourself. Maybe it's self-doubt. Maybe it's that you got some negative feedback and you're starting to lack confidence in your job or in a role. And then it's like you start to spiral. And then I think it truly is self-love, slowing down and being like, hold on. Wait, let me sit with this thought for a minute. What is true about it? What isn't true about it? And how can I like pull myself back into
Cody.
Positivity.
Positivity.
I love this.
We love them all.
Sorry, I've said I love this to every single one of them.
Good. We just love you guys and what you have to say.
Yeah, this is Anna. Anna, not sure. I'm sorry. But she wrote, talking to myself like I want my daughters to talk to themselves.
Yeah.
Yes.
Yes, we're all about that, like that loving self-talk. And we've talked about it a little bit before where it feels a little bit cheesy and forced when you first start, because especially if you have been in like a negative thought pattern and you have really negative self-talk, it feels hard. But it is one of the best things you can do to kind of change the trajectory of your day and then your weeks and then your years and so on. So big one. I love that too.
Filling your own cup and not feeling bad about it from Courtney. Leah, accepting yourself where you are, flaws and all, but mostly giving yourself credit for your good traits.
Yeah.
Love it. Marcy, taking time to do something for yourself, even if it's just a bath. Malak, look in the mirror and say, oh, this is like something that you recommend, Cody. I love this. Look in the mirror and say positive affirmations to yourself. Yes, it's okay to love yourself too. And last, Natalia, finding the moments to appreciate everything you've done for yourself and things that you are proud of.
Well done, girls. Good stuff right there.
And there's so many more. Like, yep. I love it.
I do too.
These are great things. This is what self-love means to us and also to our Mixers community. We love that there is great input out there from you women. Thank you for like giving submissions and giving other women good things to think through.
It's a supportive community. We love it. Yeah.
Now we can get into the episode. Mixers is a company made for women by women. Each of our products have been carefully and lovingly crafted to support you in all stages of your life, providing you with the optimal health you deserve. Each ingredient we handpick is 100% all natural, backed by science, and chosen specifically to better your life physically, mentally, and hormonally. Each product empowers your body to take charge of its monthly hormonal shift and flows, empowering you to live life to the fullest. Let Mixers take care of your needs from sunup to sundown, and you take care of the rest. Check us out at mixers.com, MIXHERS.
Okay, we're back. This is going to be so fun. Let's give Sine an opportunity to say hello to everybody and tell us a little bit about you and where you're from.
Sure. I'm Sine. I'm a UX designer here at Mixers. I'm from South Africa. I've been in Utah for most of my adult life. It's been about 12 years and I love it. It's great.
Love having you. Where are you originally from?
Durban, South Africa.
Okay, awesome. And then you know Jess, but the reason I wanted Jess specifically on this episode is because Jess has lived internationally. So she's got such a great point of view of like what's not only happening here in the United States, but like she lived in several countries in Europe. Where are some of the places you've lived?
Yeah. Well, thanks for letting me be a part of this conversation. Like, fun fact is that my twin daughters were born on International Women's Day. And there is something about that, like having these two daughters that are born on such an incredible holiday that like fires me up as a mother too.
Oh, yeah.
But yeah, I do have experience living in various different countries. My kids were born in different countries. So I lived in Spain, Italy, Turkey, and Russia. And I was pregnant in Italy, pregnant in Spain. I definitely had a lot of medical care experiences, both overseas. And then, I just think that I can hopefully provide some insight to this conversation.
Yeah, absolutely. Plus, you're just fun to have on here. And we'll use any
I'll
excuse.
bring the fun.
Yeah, she's going to bring the fun. Because I am going to be talking about some stats and stuff. I do think that they're
just so intriguing.
Yeah.
And you already said it earlier, mind-blowing. It's true. We review these sorts of statistics in the office.
Yes.
And it's frustrating.
It is frustrating. And it's interesting to me that not more women understand this. And so you'll hear kind of why we're so passionate about sharing some of this information, because the more you know, the better we're going to be able to help change happen. And I do see it happening. I mean, I've been in this world for almost 30 years, which is so crazy. And I have seen everything just improve leaps and bounds over the last 30 years, but there's still a lot of room for improvement.
Well, and I think the reason why Mixers cares to have this conversation is first and foremost, women's health, of course, but also we want to be advocates for change and improvement and hope. So we're not trying to have this conversation to be like the Debbie Downers that are just so angry and we're going to be mad forever. It's like, let's all be aware and let's see how we can be helpful. Let's see how we can advocate for ourselves, also the women around us. And it's so great to have information. So
information, knowledge is power, right?
Yeah.
Okay, so let's just start talking about some of these stats. I had to bring my little iPad for those of you that are watching us on YouTube. I usually don't read from this, but I'm not going to have these studies memorized, and I want to make sure I get all the stats correct. So we're going to just talk about historically what has happened when it comes to clinical studies and when it comes to diagnostic criteria and things like that. In history, what all of this has usually been focused on is data from men, okay? And you know that I've talked about this quite a bit, but what I think is so fascinating is that it wasn't until 1990, which some of you weren't even born yet, but for me, that just seems like last year. It wasn't until then that the National Institutes of Health, or the NIH, which we've become more familiar with, they created the Office of Research on Women's Health to address how a lack of systemic and consistent inclusion of women in NIH-supported clinical research could result in clinical decisions being made about how healthcare for women is used based solely on findings from studies of men, without any evidence that they are applicable to women. So if that makes sense to you, they're basically recognizing that we're just using these studies that were done on men and just assuming that everything would be the same for women. But the reason that this happened is because, as we've talked about before, as women, we're cyclical beings. That means that our hormones are fluctuating consistently throughout the month, which makes us very hard to test. We're not the best test subject. Well, we are, but we make it hard for people, scientists that are studying and using the same kind of outline for testing as they are using on men. They have to create a totally unique studies in order to include women in these studies. And so that's a huge thing. And then what I think is so fascinating too, 1990 wasn't that long ago, but 2015, everybody listening that was alive around then, it was only then that when the NIH required medical investigators to consider sex as a biological variable. Okay. So they also required that to receive grant funding, which that'll make things happen. Both sexes must be included in research or provide a valid reason for why one sex is excluded. Unfortunately, despite measures to reduce the data gap between sexes in clinical research, the issues still exist, but we're getting somewhere. So the reason this is so important is because there are so many consequences that can come because of this lack of data and the lack of women being used in these types of studies. For instance, like diagnostic criterion and like disease pathologies they're informed by data from men, despite the fact that women present disease differently. We aren't just little men, right? And so excluding or underrepresenting women in drug trials has also a lot of damaging effects. And for instance, 1.5 to 1.7 women have greater risk of having an adverse drug reaction compared to male patients. So all of our pharmaceuticals that are out there. A reason for this is that females may biologically metabolize and react to drugs differently. It also may mean that some drugs or some drug doses should be different for men and women, and that this was found to be true in an American sleep medication known as Ambien, where the recommended dose was found to be double as much as women should consume. So this is a very popular prescription, but it wasn't just until recently that they started recognizing that the dosage that they were giving to both men and women was twice the amount that women should be getting. Isn't that crazy? I know. Have you guys had anything like adverse reactions or anything it's hard to say, right? Because it's so
not
new.
that I know of.
Yeah.
I mean,
not personally, not adverse reactions, but just the consideration of taking medication. With having my babies, like my hormones were just all over the place. And I had like a postpartum depression diagnosis. And with one of my kids, it was like a prenatal thing. And so trying to find information of like, is this medication safe to take while pregnant? What are the adverse effects? And this is like a big decision, right? Because it felt like life or death. Because it's like, well, do I take this to keep myself okay? What about my unborn child? And just not having access to that kind of data is really hard. And there's a hospital in Utah. I think it's called the Huntsman Mental Health Institute now, but it was uni before. They, a few years ago, just instituted like a maternal mental health unit. So like you said, there are great strides being made, but at the time it felt like such a weighty decision because of lack of information. So,
and it's going to take time for that,
for sure.
Even though they're doing better now, including women and like considering all of this for women, it's still going to take time. That research is not going to be out probably for it takes a while. I mean, I think this day and age where we've got like faster communication, things are happening faster. But it used to be that it would take like 30 years before research that was done was actually being put into practice, because you have a lot of educating that has to be done for doctors that are doing the prescribing and so forth. Yeah. Amazing. Okay. Well, you talked about it a little bit, but we're going to go into just how all of this is affecting women and their reproductive health. Okay. There was a public health survey that found that 31% of women reported experiencing severe reproductive health symptoms in the last 12 months, such as heavy periods, infertility, menopause, and incontinence. Unfortunately, this survey also reports that over 50% of women who experience mild or severe reproduction health symptoms do not seek assistance. Isn't that crazy?
Yeah, so wild.
I know. I think it's a lot of women just feel uncomfortable, or they're maybe afraid to talk to healthcare professionals and stuff about symptoms that they're experiencing, because then that keeps them from getting the care that they need. But I know you were sharing, Sine, some history of you before you moved to the United States when it comes to this.
Yeah. So I don't know what was going on in my body, but I needed to see an OBGYN, and most of the doctors are men. And so I was like, I cannot go in there by myself. And so I had to bring my poor husband along. So I'm like, well, you're going to add credibility to my symptoms.
Like they would listen to you better.
They would listen to me if my husband was there. Mm-hmm. But also just the concern of like, how am I going to be treated by this doctor? Personal safety, all that stuff, as a woman. So
interesting. Have you ever experienced anything like that?
Well, I know that this is before her time, and this was actually part of my hormone health journey without knowing that that's what journey I was on.
Right.
When I was postpartum with my twins, I was feeling like ebbs and flows of maybe some anxiety, some depression, some hard times sleeping, just was not feeling like myself.
Yeah. Mm-hmm. Yeah.
And I didn't really know what it was. I had never previously, yes, I've experienced stress. Yes, I've been anxious about situations, but I had never felt in my life before, this is what depression is.
Right.
Or really trying to dig into that. So I was having some of these feelings and wanting to solve for it, and knowing this is not how I want to feel long term. Right. Knowing I wanted to get back to it. Yeah, knowing I wanted to get back to just feeling more consistent with my mental health, with mood, overall health. And so I went to a doctor. This was in the States. It actually wasn't over in Europe. But I went to the doctor, and I just was expressing these kind of mood swings and just wishing that I could feel happier more of the time. And this was documented on my chart as having severe depression and needing to be analyzed for some time. That was not how I was feeling.
Wow.
I was not. And I know that women can go through experiences. This is not to shed any sort of this is why I'm frustrated about it.
Right.
This is actually why I'm angry about it, is because I'm a woman that wasn't there, feeling suicidal, feeling that most of the time I wasn't myself. It was this is happening infrequently, but it's frustrating enough for me to ask for help. But it was documented in a way to where I was needing to be, what's the word? Have frequent visits. They had me come in
they were
monthly for this.
They were worried that you were suicidal is what it sounds
like. So, truly I wasn't having those thoughts. And it was so frustrating because then I was denied any sort of life insurance for 2 years over this. And I went back to this doctor and I expressed to her, this is not what I explained to you. What you put in my chart is not the feelings that I've had. I was expressing to you what I know is postpartum depression. I was just postpartum and struggling to juggle having 2 babies, low on sleep, caring for a toddler, I felt that I could go and express myself and hopefully hear, like, these are some of the, steps you can take to be feeling more regular. This is something that we should be implementing to your health routine. Or tell me, this is incredibly common.
Yes, exactly.
See this through for 4 months. And I know that there's some things with our health that, like, really we shouldn't just be told, like, this is common and be dismissed.
Don't worry about it.
But also some things, it's very helpful to be like, this is common to be feeling for 6 months. Like, let's pay attention to this.
Exactly.
Document how you're feeling on certain days of the month. Like, can you take notes about how you're feeling? Like, also there's health in telling us this is common. Let's see this through. Let's analyze this in this way. But what was so frustrating to me about this is now when I'm visiting health practitioners or doctors and I'm being seen for things, I absolutely withhold and am cautious about, or maybe I'm just like careful about what to be sharing. Cause I'm like, it really impacted then trying to get a life insurance policy. Anyway, so I had to go through a whole process to get that chart removed. And like, I think the reason why I get riled up about it is because how on earth is a woman that is feeling suicidal, that is needing support, is in a serious situation, how is she going to feel comfortable seeking help if there's like
a penalty for it?
A penalty for seeking the help.
She's not. In fact, a small study showed that of the 75% of women that reported that they were experiencing symptoms that were like menopause and all the other things, postpartum, all of these things, only 36% visited their doctor, while 50% did not seek treatment and 26% sought treatment elsewhere, not going to their general practitioner. In 2015, in fact, ovarian cancer research found that if a woman suspected a sexual health or gynecological problem, only 17% of 18 to 24-year-olds and 68% of 55 to 65-year-olds would seek medical attention. So I do think, obviously we are all about like, find a health provider that you can trust, that you can have a conversation with, who gets to know you and is like on your health team. I think that's really key. And, if it's, I'm curious, like what your doctor, how she responded after you explained all of the issues that you were having after that.
Well, I came back to her like a year later. I never went back for any of the follow-ups or anything. And I wish I would have been told things like, make sure that you're getting outside in sunlight for 15 minutes a day. Make sure that you're talking openly with your spouse or with a friend about how you're feeling. And like, I wish that there would have been some health recommendations. Which I am not against this, but I was solely recommended to get on antidepressants. I know that this is incredibly helpful and a must for a lot of women. But for me, that was not the solution at that time.
We recommend a holistic approach. And, when I was in practice, I worked with doctors who aren't always educated in giving those types of recommendations. They are very symptom-based, but a lot of doctors now are working with holistic health practitioners or functional nutritionists that can then help, support their patients along the way. I guess what I was asking though more, it was just like, did she apologize? Because this was a woman doctor. And I think that there's just a lot of education, a lot of learning that needs to happen for patients, but also for doctors on how to handle all of this kind of stuff.
Yeah, so there's just a lack of nuance, Jess. Like being on the opposite end of the spectrum, I was like, I'm one of those people who probably needed that.
Yeah.
But it's almost like this black and white thing of like, you're either really okay or you're really not okay. And like, there's no like holistic help for everything else in between,
Yeah, they want you to, it's easier if you fit in a box. It goes with the studies and everything. It's easier if we fit in a box, but none of us are going to fit in the same box. And so it's just important that we're trying to advocate for like individual healthcare.
Yeah.
So, okay, awesome. Let's go on to endometriosis because March is Endometriosis Awareness Month. So we are celebrating International Women's Day, but we got to recognize the girls that are out there that are suffering with endometriosis because this is a huge issue. It's a huge reproductive condition that is so debilitating. It has so many crazy symptoms that really, really affect things like fertility and just quality of life for these women. And it's interesting still, this is still the stat. I had read this stat a few years ago, and I was surprised to see that here we are in 2024, this is still the stat, that it takes an average of 7.5 years to be diagnosed with endometriosis. And it affects 1 in 10 women. So this is a lot of women. In fact, it's the same number of women that have diabetes. But how many of you guys know more about diabetes than you do about endometriosis? And it certainly doesn't take 7.5 years for you to get a diabetes diagnosis. And so, and it's because there's a lot of more research on diabetes. It affects equally, I don't know the percentages of this, but men and women. But where endometriosis is a woman's health issue, it's interesting. There's only $1 that's funded, towards endometriosis, as opposed to $200 for every dollar that's invested in endometriosis research, $200 that are invested in diabetes. Did I say that clearly enough? I feel like, okay, it's a big difference. $1 compared to $200. Of course, there's going to be more education. Of course, there's going to be more resources that are available to help us understand diabetes, which is so important, of course. But we need to have better research and better things, that education out there for our doctors to help these women get diagnosed much, much earlier. There are several phases of endometriosis. And if you can catch endometriosis during its early phases, many times we can prevent infertility and things like that. So it's incredibly important that this gets some attention as well. And I don't know if you guys have anything to say with that, any friends or anybody that you have.
Yeah. Actually, I just had a conversation with a friend this last week. I've been trying to get her to take her time extra strength. So hopefully she'll start and it'll be helpful. But she was just telling me that it's taken her maybe 5 years or so to get an official diagnosis. But she experiences like these debilitating period symptoms every single month. And I just learned that in order to get the diagnosis, they have to do an invasive procedure. It just blows my mind.
If you could, I don't know what the absolute answer is to this, but I think that because symptoms are so similar to several other hormonal imbalance issues that women face, sometimes they just assume it could be everything else. And it is not something that you can diagnose unless you can go in and see what's going on. It's not something you can trace like on an ultrasound or something like that. But for your friend, let her know one of the biggest reasons and one of my biggest motivators for creating her time was because my best friend struggled with endometriosis and went through 6 surgeries. She dealt with infertility and nothing. All of these different medical procedures and interventions just caused more issues for her. And it was finally when she started using her time that she started to be able to feel like she could be herself again and just show up in the world. She'd be, on the floor of her shower just because she was bleeding so much she didn't dare to leave her house. And this was not just during her period. This was like weeks of her month. I mean, it was just a major issue. So you ladies that are dealing with endometriosis, just know we're going to be doing an episode for you specifically that will be coming out in a few weeks, and we'll be diving into a lot more there. But not just endometriosis, there's also ovarian cancer, which is a very it's a very common cancer. It's not popular at all. We do not like it. But it's also one that takes a long time for women to get a diagnosis of. 45% of women, in fact, just to even get an appointment with their doctor, it takes 3 months to get an appointment with their doctor. And then it takes time for them to actually receive a correct diagnosis. This delay may mean that the cancer becomes harder to treat. A report by Target Ovarian Cancer highlights some of the difficulties women and general practitioners have at identifying symptoms of ovarian cancer, which may cause delays in seeking help and proper diagnosis more difficult. For example, only 20% of women in the UK said they can list bloating as one of the main symptoms of ovarian cancer. The reason why that's significant is because that's often the symptom that these general practitioners are asking about, but only 20% of all the people that have ovarian cancer said they even experienced bloating. The charity also reports that 44% of general practitioners think that symptoms only present themselves in later stages when they can appear much earlier. So you will start having symptoms much sooner than they're recognizing or have been recognizing in the past. This is one of the many examples where both more education for doctors and the general public is needed to help raise women's health outcomes. Yeah, we need to have conversations like this where we can become a little bit more aware. And there needs to be, maybe we need to do a whole episode just talking about things to look for when it comes to ovarian cancer and things like that. But definitely let's research on our own and let's find doctors that are also really passionate about this type of research. Luckily, we have the internet. We have access to doctors all over the world, right? Yeah, for sure. Okay, let's go into women's heart health. It's the number one leading cause of death for women. And it's something that is it's very different for men and women, the way that we are diagnosed as well as treated. It's crazy, okay? It's not only symptoms and conditions involving women's reproductive health that are overlooked. The problem happens in illnesses that affect both men and women. The Heart Foundation reported that more than 35,000 women are admitted to the hospital with a heart attack every year, but only 50% are more likely than men to receive an incorrect, 50% of those women that go in, they are more likely to receive an incorrect diagnosis after a heart attack. So they're not even recognized that they're having a heart attack. The Heart Foundation has also found that women are also, they're more misdiagnosed, just like we said. In fact, 41% of them are. One of the reasons why heart attacks are misdiagnosed in women is that there's a protein that's called troponin, okay, which is released when your body has a heart attack. And what happens is that for women, this protein is going to be released, but it's going to be released in much lower quantities than it is for men. In fact, women have 4 times lower levels of this of troponin than men do while having a heart attack. And so what this is doing, and luckily it's in effect now and it's starting to happen, is that they're developing new testing that can detect these lower levels of troponin. So that's good. That's moving in the right direction, right? The other thing is that women experience symptoms of a heart attack much different than men. You know, I think we always think of it's like, pain in the chest and shortness of breath and things like that, discomfort and things like that. But for women, a lot of times it can be that shortness of breath. It can be back pain. Sometimes we think that's just cramping, right? It also can be jaw pain. It could be nauseousness or vomiting. So you could think this was a million different things.
I think you could have flu.
You could, but you could be having a heart attack. So more awareness is needed to help people identify that women may experience different symptoms of a heart attack than men do in order to improve health outcomes. That's so crazy, right? Okay, let's talk about one more area of this, because there's actually so many areas of women's health that we could address and hope and pray that talking about will help improve. But let's talk about women and pain management. I knew you guys would get a reaction because I feel like we all can relate. I bet everybody listening to, or watching us today can tell us a story when it comes to this. But men and women feel pain differently. And now, luckily, science is showing that this is true. We've known this forever. I feel like as women, instinctually, we know this. Like women and men do feel it differently. But there are some studies that suggest that there are biological reasons for why males and females experience pain differently. And it could be connected to hormonal differences in males and females, such as estrogen, progesterone, and testosterone, and why pain may be experienced differently, which makes sense, right? It actually affects the way that our brains function. Our brain has the highest number of receptors for hormones. And as women, you know what I mean? And men are going to have this too, but we're wired differently. This makes sense, right? I think also because this is science according to Cody, but
which is the best science.
We kind of are required to experience pain, we're wired to be able to birth babies, I feel like there's a blessing in that we feel pain differently. It allows us, not that it's not painful, but it allows us to maybe handle it a little bit better. So there's, a lot of that. So
something I feel about women and pain is like, I don't want a blanket statement,
sure,
but I think this can be something that comes up like in relationships. Like it can be something that we hear about the man cold. And women have, it is common for women to just continue doing the caretaking, continuing to run the kids around and things like that. And then men more commonly are knocked out from a cold. And I feel like women
See, we need to be nicer, huh? Yeah, but it's true, right? Yeah.
No, I sorry. The point I'm trying to make in this though is like, I almost feel like as women, we don't necessarily, I think the man cold stigma or truth, whatever you want to make of it.
It's actually science and it's true.
Almost like it's happened because women have been told so many times, you're okay. Like, just keep going. It's okay. You're okay. This is normal. So it's like, even when something is like putting you what feels like on your deathbed, you're like, I'm okay. I guess I just like, I keep going.
Yeah.
And nope, I got 20-minute nap, but like, I still need to go and do carpool. Or like, I know for me, when I was giving birth in Italy, oh my gosh, strangest experience. I was put in a room with like 15 other women. And we're all just in these like little dinky hospital beds. I don't even think it's like a cot, maybe.
Yeah.
And I remember being there and like looking around at all of these women just like wailing in pain, myself included.
Yeah,
like,
of course.
So much pain. No epidural, no Tylenol, no ibuprofen, no pain medication whatsoever. And I remember looking around and thinking it was so interesting. There are fantastic male doctors.
Of course.
But we were all being monitored by one male doctor. And I felt like something that was interesting in that situation of like all of these women that are in labor, active labor. Is like knowing, I'm in a foreign country and I'm with someone that doesn't understand what I'm going through at all.
Yeah.
And that's not to like, I know it's beautiful as women to be able to experience birthing a human. Like, we're so grateful.
Absolutely.
But it is so challenging to like be expressing what our bodies are feeling happening. Like and what is going on. And I just remember having this moment like in that, being like, A, I don't know how to ask for help because I'm in a foreign country. B, how do I explain
what the heck is going on down there?
But I've had very, very positive experients with male doctors in other ways. So it's like,
absolutely.
Anyway.
Yeah. Some of my favorite doctors that I refer people to all the time are men. They absolutely can study it and they have big hearts and they care about women's health. They're out there for sure. There is a bonus when there is a woman who can absolutely like, they relate to you and they have been through what you've been through. I feel like that is nice for us as women, but it's not the only place to look for support. I think we can just appreciate really great practitioners that are out there that are passionate about this. Well, yeah. So, I mean, I feel like we all have, first of all, women are just incredible. Jess, you're incredible. And those women that were all in there birthing at the same time. Unreal. I mean, we have been doing
I'll never unsee it.
No, you'll never unsee it or unfeel it or unexperience it. It's amazing. And we're really blessed, to have modern, medicine that can help us to be able to go through. But, women have been doing this from the beginning of time, and it's just, it's unbelievable. So now there is proof, there is scientific proof that shows that we are definitely wired differently and we experience pain differently. It doesn't mean that it's not as painful. It's just that we are able to deal with it a little bit better. Does that mean to say? But that's what the science says. Okay. So it also just shows that, that it's not just that we deal with pain better, but women actually have more chronic pain than men. We also are diagnosed with more autoimmune issues and conditions than men. So there's kind of a lot. So it just highlights the importance of women being adequately represented in the medical research, to understand both why they have higher rates of autoimmune disease, and also if there is a need for different approaches to managing specific autoimmune diseases or even pain or just any other health condition, between men and women. Okay, well, in conclusion, here in the United States and throughout the world, inequality in healthcare between men and women persists. The systemic problem touches all levels of healthcare, of the healthcare system, from how research is conducted and funded, the testing and diagnostic criteria and interactions and medical interventions with healthcare providers and outcomes. Increased medical research with a greater number of female participants is absolutely crucial. There needs to be more resources and guidance to improve diagnostic criteria and time, understanding of disease pathologies and medical outcomes. Now, we have to build awareness and trust to empower women to talk to their doctor when they feel that something isn't quite right. General practitioners also need to receive greater training on female-specific problems so that women are diagnosed earlier and their health concerns are taken seriously and not dismissed or marginalized. While focusing on the inequalities in healthcare between men and women, we must also acknowledge that even among us as women, there are inequalities that exist that are needing to be addressed. There are inequalities in women's health outcomes varying by race, ethnicity, religion, sexual orientation, and so on. Now, at Mixers, we want to break down the barriers that women face in healthcare by giving them a greater understanding of their own health. We want to empower women so that they feel more in control over their own health and have the confidence to seek medical help if there are problems that arise. Now, we support all the work being done by healthcare professionals, the researchers that are out there, the scientists, and the growing number of female-founded healthcare businesses like Mixers, who are also passionate about raising awareness around the taboos surrounding women's health needs. And also, like us, we support those women who are out there that want to be a part of a growing movement with the intention of driving equality in female health. So, this has been a fun episode. I appreciate having all of the girls with me today. Thank you so much. We thank you for tuning in to this episode, and we hope you enjoyed it. And we hope that you have a very happy International Women's Day week. I know this is going to be airing a couple days before the actual holiday, but at Mixers, we celebrate women every single day of the year. And we appreciate you being a listener to our podcast and for tuning in on YouTube. We love this community and we love each of us in the way that we contribute to each other's health and happiness. All right, until next week, I hope you all have a very happy and healthy week.